Good afternoon, Dr. Brick. My name is Bello. I'm here to do my tutor assessment. And here is the 360 degree of my space. Here is my patient. And here is my videographer. I've cleaned my stethoscope. I've cleaned my pen light. I've done my hand hygiene. And if I have glove, I'll be wearing one. Meeting my patient. Good afternoon. My name is Bello. I'm here to do an A2. My name is Bello. I'm here to do an A2 assessment with you. And I'm a student nurse. Can you tell me your name and date of birth, please?
My name is Samuel Imina, April 27, 1995.
Good. Am I able to do the assessment with you now?
Yes.
Consent taken. Do you want to use the washroom?
No.
Comfort given and privacy provided. Moving on to the general survey. Tell me your age, please.
28.
Patient sexual development appear as stated age. Color, patients is dark brown and patients is dark and even. Moving on to body structure, patients is in a sitting position with good muscle tone. Patients appear well nourished. Patients, there is no physical deformity seen. Behavior, patient is able to maintain good eye contact. Patient's face is relaxed. Patient's facial expression is relaxed. Patient is hygienic and dressed appropriately for the occasion. Moving on to dress appropriately for the occasion. Moving on to mobility. Can you take a walk for me, please? And back. Patient's gait is balanced and steady. Walk or breath, there's no distressed breath seen, and there's no nipple breath seen. Moving on to neurological and highs. Level of consciousness. Can you tell me your name?
I'm Samuel.
Where are you?
I'm at the library.
What day of the week is it?
Monday.
What date?
27.
Patients is alert and oriented to time, place, date, and day. Oriented times 4. Moving on to cranial nerve 7, which is facial nerves. Can you pop your cheek for me? Close grimace. Smile. Show your teeth. Frown your face. Raise your eyebrow. Close your eyes while I try to open it. Patient motor function is symmetrical. Therefore, facial nerve 7, which is facial nerves 7 is intact. Now, moving on to cranial nerve 3, which is oculomotor nerves. I will be using Pella to assess my patient, starting with the pupil size. The pupil size is 3 mm, equal and round bilaterally. Moving on to the light reflection of the light. Patient's left pupil constrict on direct light reflex, while the right pupil constrict on concentric light reflex. Patient's right pupil constrict on direct light reflex, while the left pupil constrict on direct concentric light reflex. Moving on to accommodation. Can you look at the tip of my pen while I bring it close to you? Patient has a normal pupillary constriction and convergence of the axis of the eyes. Therefore, cranial nerve 3, which is oculomotor nerves, is intact. Moving on to cranial nerve 8, which is acoustic nerves. Here I will be doing the whispering test. Can you cover your triggers of your ears?
White. Green. Red. White. Green. Red.
Patient was able to hear whisper words at a distance of 30 centimeters. Therefore, cranial nerve 8, which is acoustic nerves, is intact. Patient nose is at the midline. There is no discharge and there is no flaring. Moving on to cranial nerve 9 and 10, which is glossophages and vagus nerves. Here I will be assessing. Can you put into your head back? I say ah.
Ah.
Patient soft pellet and uvula rises when patient says ha. Therefore, cranial nerve 9 and 10, which is glossophages and vagus nerves, is intact. Now moving on to musculoskeletal. Can you pull your hand back for me? Stay back. On assessment of the hair scale, the color is dark and even. There is no scarring, there is no lesion, no physical deformity seen, and there is no motion. Upon palpation, any pain or tenderness?
No.
No pain or tenderness. There is no masses. There is no excessive motion. So, body temperature. Body temperature is warm bilaterally. Joint temperature is warm bilaterally. Now moving on to capillary refill. Is plunged bilaterally, less than 2 seconds, which indicates good blood circulation. Can I do the radial pulse? Counting for 30 seconds times 2. Rate is 60 beats per minute. Strength is 2 plus equal bilaterally, and rhythm is regular. Can I take the brachial pulse, please? I'm counting for 30 seconds times 2. So rate is 60 beats per minute. Strength is 2 plus equal bilaterally, and rhythm is regular. Now going to the motion. Stretch your hands, bend your wrist for me. Flexion, extension, radial deviation, ulnar deviation. Any pain or tenderness?
No.
No pain or tenderness. Move to the elbow. Flexion, extension, supination, pronation. Any pain or tenderness?
No.
No pain or tenderness. Take your hand up for me. Shoulder, abduction, adduction, internal rotation, external rotation. Any pain or tenderness?
No.
No pain or tenderness. Now, can you grip my hand? Any pain or tenderness?
No.
No pain or tenderness. Patient report no pain or tenderness, and there is no crepitation sound heard. Therefore, patient has a great strength of 5 plus. Therefore, patient has a full range of motion. Moving on to the legs. Can you look at your leg for me, please? There is no scarring. Hair is evenly distributed. Color is dark and even. There is no lesion. No excessive motion seen. Now, on palpation. Any pain or tenderness?
No.
No pain or tenderness. There is no masses. Everything for edema. There is no edema. Body temperature is warm, and it is warm bilaterally. Now, capillary refill. The capillary is plugged bilaterally, less than 2 seconds, which indicates good blood circulation. Posterior tibial pulse. Counting for 30 seconds. Times 2 is 60 beats per minute. Strength is 2 plus equal bilaterally, and rhythm is regular. Dorsalis pendis pulse. Counting for 30 seconds. Times 2. Strength is 60 plus per minute. Rate is 60 plus per minute. Strength is 2 plus equal bilaterally, and rhythm is regular. Now, range of motion. Moving on to the range of motion. Can you have you stand up for me, please? Touch your toe. Flexion, extension, left lateral bending, right lateral bending, left lateral rotation, right lateral rotation. Any pain or tenderness? No pain or tenderness. Can you sit down, please? Can you stretch out your right hand leg for me? Flexion, extension, flexion, extension, flexion. Any pain or tenderness? No pain or tenderness. Can you lift your feet for me, please? Against the forces of my hand, point towards your nose. Dorsal flexion, plantar flexion. Any pain or tenderness? No pain or tenderness. Upon assessing the range of motion, patient report no pain or tenderness, no crepitation sound was heard. Patient has a great strength of 5+, which therefore my patient has a full range of motion. I'll be doing my hand hygiene. Hand hygiene done. I need you to take off your shirt for me, please. So, then I'll be assessing the posterior thoracic cavity. Can you see it on the screen? The posterior thoracic cavity. Upon assessment of the posterior cavity, the spine is at the midline. The scapula is symmetrical. Is symmetrical. There is no moisture, no deformity. There is no scarring, and there is no lesion. I'll be doing taking the chest expansion at the T10. Can you take a deep breath in? My thumb move apart when the patient took a deep breath in. Therefore, the patient's chest expansion is symmetrical. And between the posterior tibia, the posterior arterial tibia, the posterior arterial transverse diameter, posterior arterial transverse diameter is 1:2, which indicate normal findings. I'll be palpating. Any pain or tenderness? No pain, no tenderness, there is no masses. Temperature is warm bilaterally. Now moving on to is warm bilaterally. Now we'll be auscultating the 9 area, listening to the breath sound. Using my diaphragm, I need you to take a deep breath in whenever you feel the touch of my diaphragm, of my stethoscope. 1, 2, 3, 4, 5, 6, 7, 8, 9. I listened to the breath sound for 1 minute. The respiratory rate was 12 beats per minute, and the rhythm was regular. There was no adventitious sound heard, no crackles, no wheezing, and the bronchovascular sound was heard at the T2, T3, T4, and T4, and the vascular sound was heard at the rest of the lungs, while the trachea and the larynx I heard the broncho sound. Can you stand up for me, please? Lie down. Then I'll be assessing the cardiovascular. I'll be draping my patient. So here I'll be listening to the 5 valves of the heart, starting with the right door, starting with the right side, by the right median stellum. At the second intercostal space at the right median stellum is the aortic. Moving to the left side at the second intercostal space by the left median stellum is the pulmonic. At the third intercostal space by the left median stellum is the air point. Moving to the fifth intercostal space by the left median stellum is the transcupid. Move down to the mid-clavicular line is the mitral. And here I'll be listening for the apical pulse for 1 minute. And apical pulse is 60 beats per minute and reading is regular. At the mitral is the apex of the heart, which I heard the S1 sound best there, while the S2 sound and S3 sound, which is the base of the heart, with the aortic and the pulmonic, I heard the S2 sound best there. Right now I'm going to be assessing for the extra sound and murmur sound. I'll be listening to the 5 valve again. At the second intercostal space by the right median stellum is the aortic, and the second intercostal space by the left median stellum is the pulmonic. At the third intercostal space by the left median stellum is the hip point. At the fifth intercostal space by the left median stellum is the transcupid. At the mid-clavicular line at the fifth intercostal space is the mitral. There was no advertisement, there was no extra sound heard, and there is no murmur. There's no murmur, and there was no S3 and S4 sound. At the S3 and S4, there was no extra sound and there is no murmur. Now, moving on to the abdomen. Upon assessment of the abdomen, the oblique is at the midline. The hair is evenly distributed in diamond shape. There is no paresthesis, no pulsation. Contour is round and symmetrical. Color is dark and even with the rest of the body. Upon orchestration, I'll be orchestrating the 4 quadrants, starting with the right lower quadrant. For 1 minute, the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Upon orchestration of the 4 quadrants, I heard a bowel sound, which at high pitched, gurgling and cascading every 5 to 30 times per minute. Therefore, that which indicate normal finding. I'll be palpating any pain or tenderness in the 4 quadrants. Any pain or tenderness, any pain or tenderness, any pain or tenderness. Patients report no pain or tenderness, no gargling, and no superficial masses. Just before I round up, I will be palpating the bladder just above the symphysis bone. Any pain or tenderness?
No.
About palpation of the bladder, patients report no pain, no tenderness. Thank you.